Well, simply uttering the phrase child abuse conjures up images of innocent children in helpless situations. And as any adult knows, since they can't help themselves, we need to step up. In Licking County, it's a real team approach. So here to tell us more, we have Rob Montagny's back, president of Licking Memorial Health Systems, as well as Greg Wallace, who's the VP of Physician Practices and works closely with Kids Place, which is what we're talking about today. So gentlemen, thank you for being here.
Morning, Robin.
Thanks
Good to be here.
All right, Rob, let's talk about a recent piece of data. And obviously, anytime we see data involving kids and neglect and abuse, it's sad and it's shocking, but they are the facts. So we need to know what we're looking at here in Ohio.
Well, I think even the data that's out there, you could argue might be underreported because we understand and appreciate the fact that a lot of these things don't get reported to, whether it's sheriffs or certainly through the emergency room.
Sure.
But statistics suggest, 8,000 children maybe throughout the state. You multiply that times the number of states that are out there. And I know every community wants to feel or think this isn't happening in our community, but unfortunately it probably is happening in all these communities. And that's why our proactive program and approach is certainly very satisfying to know that we have things in place to really keep the children protected, to get information from them in a non-threatening environment, and to certainly take care of any of their clinical needs.
And let's talk about that then, because this is care and protection. This is a resource for these kids. So tell us what you have in Licking County.
Well, Kids Place, I think, as I just mentioned, is a very non-threatening place where they are brought, and we collaborate with many other agencies, law enforcement, sheriff's office, prosecutor's office, job and family services, and of course our clinical folks, our pediatricians, our nurses that are specially trained at one site to once again gather that information, whether that's evidence, provide clinical support, and to do it all in one very accommodating, non-threatening place. And I think that leads to our great success rate in terms of prosecution, which once again is very satisfying. We don't like the numbers, which I think we're typically around 200. Greg can confirm that. But the high, I think we're typically around 100% for the prosecution rate. And that's really what we want, is to hold those folks accountable and take care of the clinical needs for the child.
Okay, so Greg, let's talk about the care process. As the child, I mean, they're scared, right? I mean, this whole process is a scary process. So what is it that makes it so non-threatening and safe when they come to Kids Place?
Sure, absolutely. Well, I think it starts with the kids team that we have with the local law enforcement, and they just have a passion for helping these children. We have an off-site facility where when a child victim is identified, they are brought to this facility. They're welcomed by a child-friendly reception area, and our professionals are trained to deal with these unique situations with the children. Once they're there, then they're interviewed in one of our state-of-the-art exam rooms by an LMH physician or a nurse practitioner, if it's indicated for a medical exam. Then it goes into an interview, a one-on-one interview with a kids team member who is again trained to deal and ask the specific questions for those kids, so we can get the information out of them and to substantiate what event actually occurred so we can lead to prosecution.
And Rob alluded to that. I mean, the success rate is there. The proof is there that this whole process and what you're doing is working, right?
It is, yeah. So in 2015, I think we had about 225 referrals to the Kids Place. And we ended up prosecuting, we substantiated and founded data that we prosecuted 74 perpetrators of those 225 accusations. Year to date 2016, and we're looking right around 200 cases again, with about 50 cases that are set to be prosecuted of these perpetrators.
And Rob, I believe this has got to be an entire team approach in order to be so successful in what you're doing.
There's no question. The collaboration amongst all the entities is, I think, critical. As I said earlier, certainly taking care of the clinical, the psychological needs is our role, but working closely with law enforcement to make sure they get the information they need to further investigate and ultimately prosecute if warranted is obviously crucial. And then job and family services to provide other types of support for the family during this time. Working together is really what allows our community to have such a great track record.
And we have the phone numbers up on screen. If you do have the unfortunate situation where you need to report a case of abuse, of neglect, there are a couple of different places you can go. There's 24-hour help from one capacity or another. And then, of course, it leads to the great program that you guys are offering to your community. So I want to thank you for bringing that to Licking County.
Absolutely. It's not a very pleasant topic, but we're pleased that we have the service available in our community.
Absolutely. All right. Thank you guys so much for being with me.
Thank
Thank
you.
you.